Safe Harbor Free Clinic meets the needs of those who are underinsured or do not have insurance. We serve Snohomish County, Skagit County, and Island County, part of Camino Island. Essentially, we serve anyone that does not have the ability to afford their medication, afford services, and we also do referrals and partnering with other organizations to offer those medical services. The need for dental services in the Tri-County area is great. We have many patients that do not have any type of dental insurance. Whether they actually are on Medicaid or other types of insurance, they still do not have dental insurance. Safe Harbor Free Clinic began their partnership with Medical Teams International, University of Washington, and Skagit Valley College in creating this dental clinic. The idea was that we could afford to offer healthcare through partnerships with these organizations. So patients come through Safe Harbor Free Clinic and then go into the dental clinic itself. So they're not only having their dental need assessed, but their overall health.
Okay, any sinus pain?
The value of this project with the dental school is enormous. It really helps both professions work together side by side, literally, as they're doing these histories and physicals and learning what each other does.
So I'm just going to be painting on the forehead here. I'm going to do half, he's going to do the other half.
Learning the concerns and the priorities of each side, and also learning to anticipate each other's needs. Dentists learn more of the medical aspect, how things are approached from a primary care perspective.
All right.
And PA students understand the needs and necessities of good dental care and the importance to stress this to patients in a primary care setting.
I think that interprofessional education is really, really important because our patients don't come in with just their mouth and that's, to be fixed.
Okay, gotcha. Where is the osteoarthritis?
They often have medical conditions or taking medications that can impact their oral health.
Slows your immune system down so it doesn't eat your joints.
Gotcha.
The patients come here, the Northwest Career and Technical Academy, with this beautiful facility, and also Medical Teams International, who have a van out in the parking lot. They do paperwork, medical history, fill out some forms. They then are evaluated by the PA, a dental student team.
So I'm just going to palpate your lip.
And then from there we make a determination, okay, here's a snapshot of what the problems are medically, and here's dental needs, and is the patient okay to go forth with this? After they get evaluated by the team, then the dental student, together with the faculty, determines what radiographs are needed, if at all. And then we have a separate station where we have our portable x-ray unit.
X-ray.
Then whatever the procedure, whether it's extraction or filling or cleaning, is done. And then if the patient has a medical condition or something that needs a little bit more follow-up, then at times we'll have the patient return to the PA, and the PA can give some advice or talk further, and then they make a report that is evaluated by Safe Harbor.
Take care of yourself, okay?
Where those who are receiving their medical care can then be followed up.
Possible to watch. You watch the pull that.
Yeah.
Yeah. Tooth, or is that something that I need to be gowned up for?
I think it should be fine. As long as you're not too close to the patient.
Okay. Cool. Sweet.
I wish we had vans in every state. Even people that are covered medically still do not have the dental insurance option, available through their work, and it's very expensive to get otherwise. So a lot of people just, kind of do without, and it's, so it's nice to have this option for them.
Yeah, okay, Rebecca. Then you can for me, please. All right.
If you bring the students together, particularly in an outreach setting,
138/70.
they really teach each other, and their motivation comes from the patient who's sitting in front of them and who's going to have different problems and different needs.
This is an orchestration of several organizations from different parts of Western Washington coming together and making this happen, which I think is just absolutely phenomenal.
So thank you all for giving up a Saturday.
Then you're gray, you're green, and then that.
People don't come up here on a Saturday just to deliver health care. They really are delivering so much more. Patients leave without that tooth abscess. It's going to keep them up at midnight. They leave feeling like, wow, I really have a little bit of hope now that next month I can come back and feel a little bit better and I can potentially go back to work and continue on with my life.
Our granddaughter helping. Oh yeah, that's great. And adorable. Oh my God.
When you live in an environment that you lack resources, lack health care, that affects your entire being. And so the people that deliver that to these patients, it is so worthwhile, it is meaningful, and it does change lives.